Hello, everybody. My name is Bree, and I represent Core Virtual Solutions. I will be supporting this webinar as your moderator, and I can't wait to begin. First of all, I'd like to thank everybody for joining us minutes before we officially start. At this time, I see about a total of 25 attendees who have joined us. We appreciate you for joining us on time and to allow the rest of those who still wish to catch up, get settled and join us. We will allow about 5 minutes before we start. So this means you still have time to get coffee, grab a bite, or better yet, scan the QR code that you see on the screen. Through this, you can sign up and submit your questions that we will answer during the Q&A session later on. And when you do, you'll also get a freebie post webinar. So we encourage you to scan that code away. Good morning once again, or good afternoon. My name is Bree, and once again, I am from Core Virtual Solutions. I will be moderating today's webinar. So welcome to your virtual team. Go from surviving to thriving with resilient strategies for small practices, NPs, and PAs. This is a unique webinar because it's collaborative and it's focused on delivering resilient strategies to enhance healthcare delivery, reduce burnouts, and foster more thriving medical teams. In today's rapidly evolving healthcare industry, small practices, nurse practitioners, and physician assistants face unique challenges, from growing patient demands to administrative burdens. This webinar aims to equip you with the tools, strategies, and collaborative opportunities that will enable you to overcome these hurdles. I am excited to present today's timeline. Besides the timeline, you'll also notice a QR code at the bottom of the screen, as mentioned earlier. You can scan it to submit questions, and we can answer those questions during our Q&A session later. And a freebie is at stake, so please scan away. We are honored to have this opportunity to collaborate with collaborating docs to help you take action and build a more empowered healthcare workforce together. I'm so proud to introduce the businesses we have here present. First, we have Core Virtual Solutions. At Core Virtual Solutions, we specialize in providing virtual medical assistance and support staff tailored to meet the specific needs of healthcare professionals. By streamlining administrative tasks, we empower small practices and healthcare providers to focus on what truly matters, and that's delivering quality patient care. We also have one of our trusted affiliate partners, Collaborating Docs. Collaborating Docs has a remarkable mission, and that's to make it easier for NPs and PAs to expand their patient reach by matching them with collaborating physicians. With over 4,000 successful matches, their commitment to giving healthcare professionals the freedom of choice is both inspiring and essential in today's healthcare ecosystem. Together, Core Virtual Solutions and Collaborating Docs are dedicated to one mission, and that's to help healthcare professionals build stronger, more resilient teams. So now that we know the timeline, let's introduce our speakers for the day. And as we said, this webinar rather, will explore how virtual staffing and physician collaboration can help you thrive by alleviating administrative burdens, enhancing patient care, and reducing burnout. It's my privilege to introduce our speakers, and the first is our Business Development Manager from Core Virtual Solutions. His name is Cameron. We also have the CEO and founder of Collaborating Docs, Dr. Annie. Welcome, Cameron, and thank you for joining us, Dr. Annie. We can't wait to hear from you. So let's begin and dive into these strategies and how they can help you achieve balance, improve practice efficiency, and ultimately provide better outcomes for your patients. So looking at our timeline once again, we'll dive into the urgent need for resilience in healthcare. And once again, a quick reminder to our attendees, you can use the QR code, scan it, submit questions. We'd love to answer them later on during the Q&A session. I'm giving the floor to Cameron. Once again, he is Core Virtual Solutions Business Development Manager to discuss the first part of the urgent need for resilience in healthcare.
Hi, good morning, everyone. Thank you for attending this webinar. As Bree mentioned, my name's Cameron, and I'm Core Virtual Solutions Business Development Manager. Before we start exploring how we could build resilient teams, let us first discover the why behind the urgent need for resilience in healthcare. Let's dive into the current global healthcare challenges. Resilience is more than just a buzzword, it's a necessity. The healthcare industry faces constant challenges that require adaptability, endurance, and the ability to recover from setbacks. One of the setbacks we often face is global healthcare challenges. This is one existing global pandemic, a new disease or new strain of existing disease spreads worldwide. The global health industry remains vulnerable to emerging infectious diseases, as demonstrated by recent data on COVID-19 and Mpox. According to the data from the World Health Organization, COVID-19 pandemic reshaped healthcare in 2020 with 776 million reported cases worldwide. Did you know that there are still over 249,000 new cases within the last 28 days alone? Now in 2024, Mpox has become another global health concern with 17,000 confirmed cases. While these numbers may seem smaller in comparison, they remind us that pandemics are still within our reality. Both COVID-19 and Mpox underscore why resilience in healthcare is still an absolute necessity. Another global healthcare challenge is the lack of healthcare professionals catering to patients. The Center for Disease Control and Prevention reports around 900 million outpatient visits each year in the US, including visits to doctor offices, hospital outpatient departments, and emergency rooms. Did you know? The Organization for Economic Cooperation and Development reports that there are approximately 2.67 doctors per 1,000 patients in the United States. This ratio highlights a critical challenge in healthcare. The increase for demand for medical service is outpacing the supply of healthcare providers. In fact, the AAMC projects a shortage between 37,800 to 124,000 physicians by 2034, with primary care being the most impacted. As patient loads grow, many healthcare professionals, particularly those in smaller practices, are facing overwhelming administrative and clinical burdens. These global healthcare challenges have led to staff shortages, increased workloads, and the widespread burnout, a reality faced by healthcare workers across the globe. Healthcare professionals, especially in small practices, are feeling overwhelmed by the constant pressure to handle new public health emergencies, maintain patient care standards, and keep up with the fast-paced change in medical field. These issues are not just problems of today, but challenges that will continue to impact the healthcare system and the way we cater to patients in the future. Go from surviving to thriving. This is at the core of the webinar's theme, thriving with resilience. Today, we're here to explore how we can face the healthcare challenges of today and tomorrow through virtual solutions and collaboration that empower healthcare professionals, reduce burnout, and foster a healthier, more sustainable work environment. That's why building a resilient team to tackle these challenges is not just important, it's an urgent necessity. Next, Dr. Annie will share insights on how to establish such a team in the upcoming discussion.
Hi, everyone. I'm Dr. Annie. I'm a family doctor and the founder and CEO of Collaborating Docs. We help NPs and PAs connect with collaborating physicians across the country. And I'm very passionate about empowering healthcare professionals to expand their practices, provide better patient care. Outside of work, I am a proud mom of 4 very young children, which means I'm always balancing the joys of parenting with the challenges of growing a business. So moving on to the next slide, first want to talk about what is resilience in healthcare. So resilience is the ability to recover from or adapt to challenges or stressful situations. I like to think of resilience as the rubber band of healthcare. No matter how much you're stretching it, it's going to snap right back. Resilience isn't just about bouncing back, though. It's about bouncing back even stronger. So once I talked to a nurse practitioner who told me she felt like she was a firefighter in scrubs. She's constantly putting out fires, no time to focus on the bigger picture of her practice. So after building a more resilient team, she really changed from feeling very burnt out to feeling like she had control of her practice. And that's the power of resilience in healthcare. On to the next slide, we'll talk a little bit about contributing factors to burnout. So burnout obviously is a very overwhelming problem in healthcare right now. Over 50% of clinicians experience symptoms like emotional exhaustion, depersonalization, reduced personal accomplishment. It's kind of like a slow cooker that everything seems okay, and then suddenly the lid flies off and chaos ensues. So having those high patient loads, administrative burdens, it's bubbles up and it can just explode into burnout. I know personally, I was a burnout family medicine physician, running from room to room, helping all the patients, then spending my whole evening documenting in the EMR. So, I've been in the trenches like all of those of you on the call, and it's kind of like playing Jenga, pulling out the administrative tasks one bit at a time, hoping the tower won't collapse on you. So moving to the next slide about emerging trends in healthcare. Luckily, we are really seeing a big shift. Healthcare providers are moving away from traditional roles and toward more independent practices, becoming your own boss, running the show. So a lot of people are trading in a 9 to 5 or 12-hour shift work at the hospital or clinic to be entrepreneurs, take control of their own destiny, their own work-life balance. Recently, I was talking to a nurse practitioner who decided to open her own concierge practice after getting very burnout in the hospital during COVID. And so now she said she couldn't be happier. She sets her own schedule, takes fewer patients, focused on an area of specialty of interest, and she's never been happier, fortunately. To the next slide, we'll talk about resilient healthcare teams. So I am a former piano major in college, so I like to think of a resilient team as a symphony. Everyone is playing their part together. They create something harmonious. So when stress strikes, the load is shared among the whole orchestra. No one person is carrying all of that weight. So, as people say, it's a marathon, not a sprint. So healthcare without a resilient team is going to put you, make you feel like you're running a marathon while juggling. It's only a matter of time before some ball is dropped. Moving to the next slide, having virtual support is definitely the secret ingredient that turns a good team into a great team. It's like having a personal assistant who helps with all the tasks you don't have time for, except this time, your assistant may not even need a coffee break. So recently I learned of a small clinic that was really drowning in paperwork. They hired a virtual medical assistant, and now the front desk is running like a fine-oiled machine. Patient satisfaction has shot through the roof, and the actual providers can focus on care, not burdensome forms and endless paperwork. Next slide is just how resilience really is that foundation for long-term success. So we're not talking about a short-term fix. This is a long-term investment, like planting a tree in your yard. It's, the stronger the roots, the more it's going to weather the storms in the future. You could even equate it to like the spare tire you keep in the back of your car. You don't think about it every day, but when you hit a bump in the road, you're certainly glad that it's there. And moving to the next slide, passing it back to Bree.
Thank you, Dr. Annie, and thank you, Cameron. Those are truly great insights. I heard relevant stats, Jenga, becoming your own boss, personal testimonial, symphony orchestra, patient satisfaction, just some of the things that I took away from all those that was mentioned, very valuable insights. Right before we move forward, I'd like to check in, ask how everyone is doing. So if I can get a thumbs up from our attendees, just so we know you're okay and still with us, we'd appreciate it. Or a heart, if you prefer the hearts better. Thanks, Summer. Okay. All right. Thank you, everyone. So we appreciate your time and your engagement means a lot to us. Once again, a quick reminder to use the QR code. We'll answer your questions later on. So when you submit and scan that QR code, we'd be happy to accommodate any questions you'd like to ask at a later time. So now that we have established the urgent need for resilience in healthcare, let's move on to the next part, and that's leveraging virtual staffing solutions. Let's explore how you can apply resiliency and go from surviving to thriving with the help of virtual assistants. I give the floor back to Cameron.
Thank you, Bree, and hello again to all of our webinar viewers. Now that we know the current healthcare challenge and the importance of building a resilient team, join me in discovering how you can thrive and strengthen your practice by leveraging virtual staffing solutions. So what are the critical roles of virtual assistants in healthcare? Based on our initial discussion, we have established that one of the most significant challenges healthcare providers face is the heavy administrative workload due to the growing patient demands. That is why we have to take resilient action by leveraging virtual medical assistants. Virtual assistants can significantly help you save time on non-clinical tasks so you can focus more on what matters, which is caring for your patients. This goes hand in hand with reducing burnout among healthcare professionals. By letting virtual assistants handle administrative tasks, you can concentrate on your clinical responsibilities, which helps prevent burnout and promotes a healthier work-life balance. Another crucial thing that virtual assistants can help is by supporting telehealth services. The rise of telemedicine, especially since COVID-19 pandemic, has eased the burden of patient volume by providing more flexible access to care. In 2021, 37% of outpatient visits included a telemedicine component, allowing physicians to see more patients without the constraints of physical office visits. While telehealth becoming a dominant mode of patient interaction, virtual assistants can provide vital support to healthcare providers as they navigate the transition. Let's take a look at Dr. Aditi Guapa, a gynecologist and sexual health expert who is one of the clients of Core Virtual Solutions. She faced major challenges in her practice. She couldn't manage all the incoming and outgoing calls due to the lack of administrative support. To solve this, she hired a virtual medical assistant to improve her call management without compromising patient satisfaction. This chart shows the significant improvement of her call management after bringing on the virtual assistant. In the first period, from June 3rd to June 10th, her practice handled a total of 217 calls. After hiring the virtual assistant, total calls were increased to 232 in the next period, which shows a noticeable difference in her ability to manage calls. In the final period from July 25th to August 16th, her practice managed an impressive 708 calls. So you could see hiring a virtual assistant allowed her to smoothly handle over 3 times the volume of patient communications. This clearly demonstrates how a virtual assistant can boost efficiency in a healthcare setting. In today's healthcare landscape, resilience is essential. Practices that can adapt quickly to challenges, maintain efficiency, and keep patient care are the ones that will thrive. This is where virtual assistants, especially virtual medical assistants, become a critical asset. Flexibility in crisis situations. Core Virtual Solutions VMAs can seamlessly manage telehealth services, address COVID or MPOX related inquiries, and scale administrative support during high demand periods to keep practices fully operational. Virtual assistants also enhance operational resilience by taking over non-clinical tasks like appointment scheduling, managing patient records, billing, and insurance claims. Lastly, virtual medical assistants can help ensure patient engagement and satisfaction through appointment reminders, follow-ups, and inquiries. Here are a few testimonials from our clients. Dr. Erica Katpis shared her experience with Core Virtual Solutions, highlighting how wonderful it has been to work with us. She praised her virtual assistant as a valuable asset in her practice, noting she's organized, dependable, and outstanding. This testimonial underscores the significant impact that a virtual medical assistant can have, being recognized as a true business asset. We also have a fantastic testimonial from Angelo Aguirre, who shared how Core Virtual Solutions has significantly boosted productivity at his agency. As a new company, they started with part-time support, and even with limited hours, their virtual assistant has been amazing. Mr. Angelo noted that every minute of the shift is used efficiently, communication is seamless, and the setup is easy. He emphasized that having a virtual assistant has greatly reduced the workload for him as the agency owner. Mr. Angelo's experience perfectly illustrates the key point of this webinar, how a skilled virtual assistant can lighten the workload and enhance operational efficiency. Resilience is the backbone of a thriving practice. While I could go on about the many benefits of hiring a virtual medical assistant, as a healthcare professional, if you truly want to thrive, not just survive in the medical field, I encourage you to book a free 30-minute discovery call. Let us discuss how virtual solutions can help leverage resilience and elevate your practice. You can find the link to schedule your call on our website, and we're also sharing it in the chat right now. I highly encourage you to book a call so we could tailor best virtual medical assistant solution for your specific business needs. Now it's time to discover the critical role of physician collaboration with Dr. Annie. Thank you.
Thanks, Cameron. Yes, so the next part, we're going to talk about physician collaboration. So as you probably know, certain states have legal requirements that do mandate that NPs and PAs have physicians to serve as sort of an advisory mentorship type of role. When I started Collaborating Docs, I really wanted to elevate what collaborating was all about. So we have even higher standards. Physicians have to be available during normal business hours for to check in with question when you have a clinical question. They have to do a video check-in once a month. They have to review 10% of charts. They have to do any other state-specific requirement. Some states have like on-site requirements and other things. So definitely it's critical to have a physician on your side supporting your practice that you can trust and rely on. For the next slide, we have a little bit of a discussion about resilience through effective collaboration. So it's not just collaborating with, perhaps a collaborating physician, but even collaborating across with colleagues, who may be doing a similar practice to your own, to different providers that you may refer to, or they may refer patients to you. You want to build the kind of network and bonds. It not only helps your practice, but it's also going to help reduce your personal burnout and boost morale of your, make you feel better about what you're doing and more connected, hopefully, to your community and surrounding medical group around you. And the next slide, we have a bit of a case study of Sarah, who was an NP that was definitely very burnt out. She was working in the hospital during COVID-19. And as so many people face burnout during that time, she made a bold step to start her own primary care practice and, do things on her terms and on her, in her own way. She did come to us looking for a physician. We matched her within just 6 days, and she was able to be up and running with her practice. And now, we check on all our clients. She's much more fulfilled, much happier. And we're just so glad she was able to make that transition. On the next slide, we have a very nice testimonial from Marlene, one of our clients, who shared that after passing her certification exam, she wanted to expand her business by seeing patients in her office. It was very challenging to find a supervising physician due to cost and location, and then she found us and has been happy. The next slide also has another happy client, Mags, who said that we made everything very easy for her. She was able to get a match within just 5 days. So that's great to hear. And the next testimonial is from Anne, who I know personally is in Texas, NP. She would recommend us to anyone who's looking for a collaborating physician, or just to see how they can serve you better. So you may even have a physician, but maybe you need an upgrade. We're here to help with that as well. And on the final slide, a little bit of information if, again, you are looking for a first time ever collaborating physician, or maybe to upgrade your physician, see if hopefully we would be a good fit for you. And we help across the whole country, all scopes of practice. And we really focus on compliance and doing things the right way, having very supportive physicians. And so if you're interested, please come to our website. We offer a free consultation with one of our nurse practitioners on our staff, who will get to know you, get to know your practice, your goals with your practice, and talk about how we can help you. So thank you so much. I hand it back to Bree.
Thanks, Dr. Annie. And thank you, Cameron. Those are remarkable success stories. We're heading towards the end of our webinar. And as we wrap up, let's take a moment to reflect on our key takeaways. So we've explored the critical role of virtual medical assistants in building resilient healthcare teams, discovered how physician collaboration strengthens practice efficiency and shared strategies to not only survive, but truly thrive in today's healthcare environment. Now it's time to take action. For those who are looking to enhance their practice by integrating virtual staffing or boosting collaboration between NPs, PAs, and physicians, the next steps, fortunately, are very simple. So for Core Virtual Solutions, we invite you to book a free discover call with us, and our team of experts is ready to assess your specific needs and guide you through the process of building a resilient virtual team that can support your practice and allow you to focus on providing the best patient care possible. You can schedule your call through our website or by contacting us directly. For collaborating docs, if you're interested in fostering stronger physician collaboration within your team, get a free code on how we can help you connect NPs and PAs with supervising physicians seamlessly. Please visit Collaborating Docs website to get started and explore how our services can upgrade, to use Dr. Annie's word, your practice. As we near the conclusion of our webinar, let's take a look at the timeline once again, and see how far we have come, right? We have accomplished or covered so many things so far. And just a quick reminder, once again, you still see that QR code at the bottom of the screen. You can scan it right before we start our Q&A session so we can entertain, accommodate, address those questions in a bit. So speaking of Q&A, I think it's time to open the floor for questions, answers. And I'd also like to remind everybody that when you sign up using the QR code, you're getting a freebie from us, Core Virtual Solutions and Collaborating Docs post-webinar. I guess we're ready to start. So from Core Virtual Solutions, myself and Cameron would be happy to answer your questions. And from Collaborating Docs, obviously Dr. Annie is going to be here to help us. So depending on the number of questions we get today, we may not be able to answer all of the questions, but don't worry. We'd be happy to accommodate them, reach out to you via email post-webinar, so we can get those queries accommodated. And I'd like to check what questions we have received so far. And fortunately, we have a question coming from the QR code displayed during our webinar. And I would love to be the one to answer the first question. And just so everybody is clear with what this question is, I'd like to read it for everyone. The question is, how do I attract more clients, and what are the best ways to market my business? This is a very good question. And to us, one of the most effective marketing strategies is to leverage or utilize social media presence. So as we all know, we have Facebook, Instagram, LinkedIn, Alignable, and so many other platforms out there that you can use to share valuable content. And these content can be anything from tips, success stories, it can be news, anything that's relevant to your audience. Please note that you can also utilize virtual assistants in handling your social media presence, so that's an option. And additionally, you can join our affiliate program where we focus on helping you market your business. And mind you, this is how Collaborating Docs and Core Virtual Solutions started as affiliate partners. So this affiliate program will not only help you build trust, but also build that credibility with potential clients, increase your reach and visibility within your community. Great question. Let's see if we have another one from those who utilized our QR code. And yes, we do. I think this is going to Dr. Annie. Our question is, how do I go about finding supervisory or directorship positions in Florida?
Okay, so the directorship role would be more perhaps a physician on the call, curious about how to join our group as a physician, which we welcome. You can go to our website actually, and there's a link you'll see at the top for physicians interested in joining the team. So yes, we would love to have you. Thanks so much for your interest.
Thanks, Doctor. Let's see if we have additional questions. I believe the next two questions are for Cameron, as this involves hiring virtual medical assistants. The first one is, how long would it take for me to hire a virtual medical assistant? And the follow-up question is, what does the hiring process look like?
Okay, I appreciate the engagement. Thank you very much. So after our discovery call, the hiring process usually takes around 3 days to a week, depending on your desired qualifications. Moving on to the next question regarding the hiring process, we try to make it as streamlined as possible. So after we book our discovery call, we take down what your needs are. So please be specific as possible. And then we're able to pair the right virtual assistant for you. Next, we'll match your virtual assistant, followed by interviews with potential candidates. After that, you'll go through an onboarding process with a dedicated client success manager who will provide ongoing support. From there, you also have an account manager to oversee your VA's performance, and they'll hold regular check-ins to make sure you're satisfied. Finally, you'll begin working with our virtual medical assistant, and our team will support you every step of the way. So if you have any questions, you're more than welcome to ask your client success manager, and we're always there to support you every step of the way. Thank you very much.
Nice. Thank you, Cameron. Just double checking once again if we have additional questions coming from our QR code. Let's see. The next question is going to Dr. Annie, and it is, how can I find supervising physician?
That is our name of the game. That's what we do. So the best thing would be to go to our website, collaboratingdocs.com, and you'll get to talk. You'll schedule an appointment to talk with one of the nurse practitioners on our team that does onboarding, get to know you. You share about your needs with your physician, and they'll kind of guide you through the process. So we try to make it as easy as possible. You can just head right to the website, and we'd love to help you.
Thanks, Doctor. And I believe that Marshall just sent a message in that chat box mentioning that he is Florida-based and looking for mid-levels to supervise. So feel free to go to Collaborating Docs website to get started. Thanks, Marshall and team. All right. Another question coming from our QR code is, are virtual assistants AI and bots or actual people? Cam, I think this is yours.
Oh yeah, so we get that question asked a lot. People think it's AI. No, they're real people just working in a remote setting. So they have previous experience working for a US medical practitioner in the past, and they're just working in a remote setting. So hopefully that helps answer that.
Thanks. All right. I see that Ken, by the way, is one of our active clients who also is an affiliate partner. He's raising his hand. Please feel free to raise your question.
Well, good afternoon, and thank you for this very informative webinar. My question to Dr. Annie is, do you collaborate with pharmacists as healthcare professionals to deliver, their services? Do you support and collaborate with pharmacies or pharmacists?
Thank you for that question. It's interesting you should ask because it's very much on our mind. This is, as many medical people on this call know, it's kind of a newer thing that pharmacists can work with collaborating physicians as to build that connection and then be able to practice medicine through the pharmacy. We do not yet. It is on the hopeful agenda for 2025 next year. But right now we do NPs, PAs, CRNAs, midwives, CNS, sort of anyone that's an APRN or an APP, but we don't just yet do pharmacists, but we want to, and we plan to. So stay tuned.
Thank you for that. But maybe through the Core Virtual Solutions relationship, we'd like to advance that timeline because pharmacists can provide services with physicians, collaborate for chronic care management, remote patient monitoring. Our company has been doing that for several years, and we actually pivoted to telehealth and now offer all of those solutions via telehealth, which is why we embraced Core Virtual Solutions and have an extraordinary relationship with their VMA, who is delivering those telehealth solutions. And we want to collaborate with physicians because we can bring more value and reduce their time and their effort in delivering needed clinical services as an enhancement. So let's see if we can collaborate with collaborating.
Sounds great. Thank you.
Love it. Thanks, Dr. Annie. Thanks, Ken.
Welcome.
All right. I think we have one more question, and this is going for Virtual Solutions, Cam. The question is, what kinds of tasks can virtual MAs provide? And is there any task that they cannot do?
Okay, that's a pretty good question. So they could handle all tasks on the back end administrative side. So depending on what your needs are specifically, they could be your medical receptionist, they could do patient intake with your EMR, EHR, patient care coordination, live scribing services, revenue management cycle. So those are some more of the popular tasks that we normally offload for clinics. And what tasks can they not provide? Well, honestly, they're not doctors, so besides what the doctor can't do, all the back end tasks they're able to handle. So pretty much everything except from taking vitals, they're able to help you with.
Love it. Thanks, Cam.
Yeah, no worries.
All right. I believe those are the only questions that were raised using the QR code. And should there be any other questions that the team or any of the attendees will come up with, we'll be sure to reach out post-webinar so we can get those queries accommodated. And as we near the conclusion of our webinar, a quick request will appear on your screen to confirm your email. So what you need to do is to simply click share, and this will allow us to forward, there, I just saw it, valuable follow-up resources and stay connected with you after this event. And that concludes our Q&A session, along with sharing your email address for post-event sharing of valuable information. We also would like to remind everybody that there is going to be a survey that will be sent in the chat box shortly. So you can use that to give us feedback. Your insight will be very valuable as we start thinking about preparing for the next webinar, hopefully coming up soon. Okay, so I believe that wraps up our webinar for today. On behalf of Core Virtual Solutions and Collaborating Docs, We sincerely thank you for joining us in our mission to build resilient teams through virtual solutions and physician collaborations. As we've discussed in today's webinar, your virtual team go from surviving to thriving with resilient strategies for small practices, NPs, and PAs. It's time to take resilient action and thrive in the healthcare industry. Feel free to reach out to us through the websites and contact information provided on the screen. And once again, to all of our attendees, thank you for your participation. We wish you a wonderful day, and we hope to connect with you soon. Thank you, guys.
Thanks for your time, everyone. Have a nice day.